Question 1. A nurse is preparing to administer insulin glargine, Lantus, to a client with type 2 diabetes. Which of the following statements indicates the nurse understands this medication? A. I will administer this insulin intravenously for rapid absorption. B. This insulin has a rapid onset and should be given immediately before meals. C. I will mix this insulin with NPH insulin to enhance its effects. D. This insulin provides a continuous, steady glucose-lowering effect for 24 hours. Answer: D. This insulin provides a continuous, steady glucose-lowering effect for 24 hours. This question tests knowledge of different insulin types, specifically insulin glargine. The key concept here is understanding the characteristics of long-acting insulin. Insulin glargine, Lantus, is a long-acting insulin with no pronounced peak, providing a steady glucose-lowering effect for up to 24 hours, which means it should not be mixed with other insulins or given intravenously. For example, a client taking insulin glargine once daily will have basal insulin coverage throughout the day and night. Remember, glargine acts like a constant glide of insulin, offering prolonged and stable control without a peak. Question 2. A client receiving digoxin, Levothyroxine, for heart failure reports nausea, vomiting, and seeing yellow halos around lights. Which action should the nurse take first? A. Administer an antiemetic medication. B. Encourage the client to drink more fluids. C. Hold the next dose of digoxin and notify the healthcare provider. D. Document the findings and continue to monitor the client. Answer: C. Hold the next dose of digoxin and notify the healthcare provider. This question tests the nurse's ability to recognize signs of digoxin toxicity. The keywords nausea, vomiting, and seeing yellow halos are classic symptoms of digoxin toxicity, a critical concept in pharmacology. The nurse's priority action is to stop the medication and report these findings immediately, as continuing the drug could worsen the client's condition, potentially leading to life-threatening arrhythmias. For example, if a client's digoxin level is too high, their heart can become irritable. Always remember to assess for toxicity and report immediately when administering cardiac glycosides like digoxin. Question 3. The nurse is teaching a client prescribed enalapril, Vasitec, an ACE inhibitor, for hypertension. Which of the following side effects should the nurse instruct the client to report immediately? A. Dry, persistent cough. B. Mild headache. C. Lightheadedness upon standing. D. Swelling of the face, lips, or tongue. Answer: D. Swelling of the face, lips, or tongue. This question focuses on recognizing a severe adverse effect of ACE inhibitors. The key concept is angioedema, a life-threatening allergic reaction. While a dry cough and orthostatic hypotension are common side effects of enalapril, swelling of the face, lips, or tongue, angioedema is a serious, rare, and potentially fatal complication that requires immediate medical attention due to airway compromise. For instance, if a client experiences facial swelling, their airway could close, demanding prompt intervention. Always remember that angioedema is a medical emergency for ACE inhibitors and warrants immediate reporting. Question 4. A client is receiving warfarin, Coumadin, therapy. Which laboratory value is most important for the nurse to monitor regularly to ensure therapeutic dosing? A. Activated partial thromboplastin time, APTT. B. International normalized ratio, INR. C. Platelet count. D. Prothrombin time, PT. Answer: B. International Normalized Ratio, INR. This question assesses the nurse's knowledge of monitoring parameters for anticoagulant therapy, specifically warfarin. The key concept is understanding the appropriate lab test for warfarin, which is INR. While PT is used to derive the INR standardizes results across different laboratories, making it the most reliable indicator for therapeutic warfarin levels. For example, an INR of 2.0 to 3.0 is typically the therapeutic range for clients on warfarin for conditions like atrial fibrillation. Always remember, for warfarin, the INR is your key to safe and effective anticoagulation. Question 5. A client is prescribed intravenous morphine for severe pain. Which assessment finding is the priority for the nurse to monitor closely? A. Constipation. B. Nausea. C. Respiratory depression. D. Drowsiness. Answer: C. Respiratory depression. This question addresses the most critical adverse effect of opioid analgesics like morphine. The core concept is understanding the life-threatening risk associated with opioid administration. While constipation, nausea, and drowsiness are common side effects, respiratory depression is the most serious and potentially fatal complication of opioid use, requiring immediate nursing intervention. For instance, if a client's respiratory rate drops significantly, it indicates a critical situation. When giving opioids, always prioritize monitoring respiratory status. It's the biggest safety concern. Question 6. The nurse is providing discharge teaching to a client prescribed amoxicillin for a bacterial infection. Which instruction is most important for the nurse to include? A. Take the medication with food to prevent stomach upset. B. Stop taking the medication once your symptoms improve. C. Report any white patches in your mouth or vaginal itching. D. You may experience increased sensitivity to sunlight. Answer: C. Report any white patches in your mouth or vaginal itching. This question assesses the nurse's knowledge of common adverse effects of antibiotics. The key concept is identifying signs of superinfection, specifically candidiasis, which is a common occurrence with broad-spectrum antibiotic use. While taking with food and photosensitivity can be relevant for some antibiotics, and completing the full course is essential, white patches or vaginal itching indicate an overgrowth of yeast due to altered normal flora, requiring intervention. For example, antibiotics kill beneficial bacteria, allowing yeast to flourish. Remember to teach clients that persistent white patches or itching during antibiotic therapy warrant a call to the provider. Question 7. A client with fluid overload is prescribed furosemide, Lasix. Which electrolyte imbalance is the nurse most concerned about monitoring? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hypokalemia. This question tests knowledge about the common side effects of loop diuretics like furosemide. The key concept is understanding how these diuretics affect electrolyte balance. Furosemide is a potent loop diuretic that works by inhibiting sodium and chloride reabsorption in the loop of Henle, leading to increased excretion of not only water but also significant amounts of potassium. For instance, a client on furosemide might need potassium supplements. Always remember that loop diuretics lose potassium, so monitor those levels closely. Question 8. The nurse is instructing a client on the proper use of an albuterol metered dose inhaler, MDI. Which statement indicates effective teaching? A. I should shake the inhaler vigorously before each puff. B. I will take a slow, Deep breath while pressing down on the canister. C. I can use this inhaler as often as needed for shortness of breath. D. I should hold my breath for about 10 seconds after inhaling the medication. Answer: D. I should hold my breath for about 10 seconds after inhaling the medication. This question evaluates the nurse's understanding of correct inhaler technique. The core concept is proper administration of inhaled medications to maximize drug delivery to the lungs. Holding the breath for 5 to 10 seconds after inhalation allows the medication to settle in the airways, improving its therapeutic effect. For example, if a client just takes a quick puff and immediately exhales, much of the medication is lost. Proper technique, including shaking, slow inhalation, and breath holding, ensures the albuterol reaches the lungs effectively. Question 9. A client has been prescribed long-term corticosteroid therapy. Which of the following potential adverse effects should the nurse include in the teaching plan? A. Hypoglycemia. B. Weight loss. C. Bone density loss. D. Increased immune response. Answer: C. Bone density loss. This question addresses the long-term adverse effects of glucocorticoids. The core concept is understanding the systemic impact of chronic corticosteroid use. Long-term use of corticosteroids, such as prednisone, can lead to decreased bone density, increasing the risk of osteoporosis and fractures. For example, a client on chronic corticosteroids might require calcium and vitamin D supplementation to protect bone health. Remember, while corticosteroids are powerful anti-inflammatory drugs, long-term use can weaken bones. Question 10. The nurse is reinforcing dietary teaching for a client prescribed phenelzyme, Nardil, a monoamine oxidase inhibitor, MAOI. Which food should the client be instructed to avoid? A. Fresh fruits. B. Grilled chicken. C. Aged cheese. D. White bread. Answer: C. Aged cheese. This question tests knowledge of crucial dietary restrictions for clients taking MAOIs. The core concept involves understanding the risk of a hypertensive crisis when MAOIs interact with tyramine-rich foods. Aged cheeses, along with other fermented, cured, or aged foods and beverages, contain tyramine, which can lead to a dangerous surge in blood pressure when combined with MAOIs. For instance, consuming a block of aged cheddar while on phenelzyme could cause a severe headache and dangerously high blood pressure. Always remember that MAOIs and tyramine-rich foods are a dangerous combination, so strict dietary adherence is essential. Question 11. A client is prescribed alprazolam, Xanax, for anxiety. What is the most important instruction for the nurse to give the client regarding safety? A. You may develop a dry mouth, so chew sugar-free gum. B. Take this medication with food to prevent stomach upset. C. Avoid driving or operating heavy machinery until you know how this medication affects you. D. It is important to continue this medication even if you feel better. Answer: C. Avoid driving or operating heavy machinery until you know how this medication affects you. This question focuses on a critical safety consideration for benzodiazepines. The core concept is recognizing the central nervous system depressant effects of alprazolam. Alprazolam can cause drowsiness and decreased coordination, which impairs the client's ability to perform tasks requiring alertness and focus, such as driving. For example, a client taking alprazolam might feel too drowsy to safely operate a vehicle. Always prioritize safety teaching regarding impaired motor skills and judgment when administering CNS depressants. Question 12. A client with a history of asthma is prescribed propranolol, Inderol, for hypertension. The nurse should question this order due to the risk of which adverse effect? A. Bradycardia. B. Bronchospasm. C. Orthostatic hypotension. D. Hyperglycemia. Answer: B. Bronchospasm. This question tests the nurse's understanding of contraindications for non-selective beta blockers. The core concept is that non-selective beta blockers, like propranolol, can block beta-2 receptors in the lungs, leading to bronchoconstriction. In a client with asthma, this can precipitate a severe asthma attack or worsen their respiratory status. For example, giving propranolol to an asthmatic client could trigger a life-threatening asthma exacerbation. Always remember that non-selective beta blockers are generally contraindicated in clients with respiratory conditions like asthma. Question 13. The nurse is educating a client about taking ibuprofen, Motrin, for pain. Which instruction is most important to prevent adverse effects? A. Take this medication on an empty stomach for better absorption. B. Limit fluid intake while taking this medication. C. Report any ringing in your ears or dizziness. D. Take this medication with food or milk to reduce stomach upset. Answer: D. Take this medication with food or milk to reduce stomach upset. This question addresses a common nursing intervention to minimize gastrointestinal side effects of NSAIDs. The core concept is understanding that NSAIDs, like ibuprofen, can irritate the gastric lining and increase the risk of gastrointestinal bleeding or ulcers. Taking the medication with food or milk creates a buffer, reducing this irritation. For example, taking ibuprofen on an empty stomach can lead to heartburn or stomach pain. Always remember to advise clients to take NSAIDs with food to protect their stomach. Question 14. A client is starting on levothyroxine, Synthroid, for hypothyroidism. The nurse should instruct the client to take the medication at which time? A. With breakfast, every day. B. At bedtime, with a snack. C. In the morning, on an empty stomach, at least 30 to 60 minutes before food. D. Any time of day, as long as it's consistent. Answer: C. In the morning, on an empty stomach, at least 30 to 60 minutes before food. This question tests knowledge of proper administration for thyroid hormone replacement. The core concept is ensuring optimal absorption of levothyroxine. Food, especially calcium and iron, and other medications can interfere with levothyroxine absorption, so it should be taken on an empty stomach in the morning, separate from other drugs. For instance, taking levothyroxine with coffee and breakfast cereal can significantly reduce its effectiveness. Always remember to stress consistency and taking levothyroxine away from food and other medications for best results. Question 15. A client prescribed sertraline, Zoloft, for depression asks the nurse, how long will it take for this medication to work? What is the nurse's best response? A. You should feel the full effects within a few days. B. It typically takes 1 to 2 weeks to notice initial improvement, with full effects in 4 to 6 weeks. C. You'll feel better immediately after the first dose. D. This medication works differently for everyone, it's hard to say. Answer: B. It typically takes 1 to 2 weeks to notice initial improvement, with full effects in 4 to 6 weeks. This question assesses the nurse's understanding of the onset of action for SSRI antidepressants. The core concept is that antidepressant medications, like sertraline, do not provide immediate relief. It takes time for the medication to adjust neurotransmitter levels in the brain and for therapeutic effects to become apparent. For example, a client starting sertraline should be aware that they might not feel better for several weeks and should continue taking the medication as prescribed. Emphasize patience and adherence to the medication regimen, as consistent use is key to achieving therapeutic benefits with antidepressants. Question 16. A client receiving chemotherapy reports severe nausea and vomiting. Which nursing intervention is most appropriate? A. Offer large, high-fat meals. B. Administer prescribed antiemetics regularly, rather than PRN. C. Instruct the client to lie flat immediately after eating. D. Encourage strong-smelling foods to stimulate appetite. Answer: B. Administer prescribed antiemetics regularly, rather than PRN. This question focuses on effective management of chemotherapy-induced nausea and vomiting, CINV. The core concept is proactive and scheduled antiemetic administration to prevent CINV. Preventing nausea and vomiting is more effective than trying to control it once it has already become severe, as these symptoms can significantly impact the client's quality of life and nutritional status. For instance, administering antiemetics like ondansetron a set number of minutes before chemotherapy infusion, and then regularly afterward, can significantly reduce symptoms. Always remember that with CINV, prevention is better than reactive treatment, so give antiemetics on a scheduled basis. Question 17. The nurse is teaching a client about sublingual nitroglycerin for angina. Which instruction is most important for the nurse to include? A. Chew the tablet before placing it under your tongue. B. Store the tablets in a clear plastic container in the refrigerator. C. Take one tablet every 5 minutes until pain subsides, up to 3 doses. D. If pain is not relieved after the first dose, wait 30 minutes before taking another. Answer: C. Take one tablet every 5 minutes until pain subsides, up to 3 doses. This question tests the nurse's knowledge of proper administration and emergency protocol for sublingual nitroglycerin. The core concept is understanding the acute management of angina and when to seek emergency help. The client should take 1 dose, and if pain persists after 5 minutes, take a second dose and call 911. If pain still persists after another 5 minutes, total of 10 minutes from first dose, a third dose can be taken. For example, if a client takes 1 tablet and chest pain continues, they should take a second tablet and immediately call for emergency help. Emphasize calling emergency services if the first dose doesn't relieve pain. Question 18. A client is prescribed spironolactone, aldactone. The nurse should educate the client to avoid which of the following? A. High-sodium foods. B. Potassium-rich foods. C. High-fat dairy products. D. Foods high in calcium. Answer: B. Potassium-rich foods. This question addresses the important dietary implications of potassium-sparing diuretics. The core concept is that spironolactone works by conserving potassium in the body. Therefore, clients taking spironolactone should avoid foods high in potassium, such as bananas, oranges, and leafy greens, to prevent hyperkalemia, which can lead to dangerous cardiac arrhythmias. For example, if a client regularly consumes potassium-rich foods while on spironolactone, their potassium levels could rise to a critical point. Always remember that spironolactone spares potassium, so dietary potassium intake should be limited. Question 19. A client is prescribed phenytoin, Dilantin, for seizure control. Which laboratory value is most important for the nurse to monitor to ensure therapeutic levels and prevent toxicity? A. Complete blood count, CBC. B. Serum albumin. C. Phenytoin blood level. D. Liver function tests, LFTs. Answer, C. Phenytoin blood level. This question focuses on therapeutic drug monitoring for a common anticonvulsant. The core concept is that phenytoin has a narrow therapeutic range, meaning the difference between an effective dose and a toxic dose is small. Monitoring serum phenytoin blood levels is essential to ensure the drug is within the therapeutic range, typically 10 to 20 mcg/ml, to prevent seizures while avoiding signs of toxicity like nystagmus, ataxia, or confusion. For example, if a client's phenytoin level is too high, they might experience slurred speech or difficulty walking. Regular monitoring of phenytoin levels is crucial for safe and effective seizure management. Question 20. A client with type 2 diabetes is prescribed metformin, glucophage. Which information is crucial for the nurse to include in the teaching plan regarding this medication? A. You should take this medication right before bedtime. B. You should discontinue this medication if you experience diarrhea. C. You need to stop this medication 24 to 48 hours before any diagnostic imaging procedure involving contrast dye. D. This medication will increase your risk for hypoglycemia, so carry a sugar source. Answer, C. You need to stop this medication 24 to 48 hours before any diagnostic imaging procedure involving contrast dye. This question tests knowledge about a critical precaution for metformin use. The core concept is the risk of lactic acidosis when metformin is combined with iodine-containing contrast dyes. The contrast dye can impair kidney function, leading to metformin accumulation and increased risk of severe lactic acidosis. For instance, if a client undergoes a CT scan with contrast while on metformin, they are at higher risk for this serious metabolic complication. Always remember to instruct clients to temporarily discontinue metformin around the time of contrast dye procedures. Question 21. The nurse is instructing a client prescribed oral iron supplements for iron deficiency anemia. Which instruction is most appropriate to enhance absorption? A. Take the iron supplement with milk or an antacid. B. Take the iron supplement with orange juice. C. Take the iron supplement at bedtime. D. Take the iron supplement with a high-fiber meal. Answer, B. Take the iron supplement with orange juice. This question assesses knowledge about maximizing iron absorption. The core concept is understanding how vitamin C affects iron absorption. Ascorbic acid, vitamin C, found in orange juice, significantly enhances the absorption of non-heme iron from supplements and foods. For example, pairing an iron supplement with a glass of orange juice helps the body absorb more of the iron. To get the most benefit from oral iron supplements, always recommend taking them with a source of vitamin C. Question 22. A client regularly takes antacids for heartburn. The nurse should advise the client to take other oral medications at what time relative to the antacid? A. Simultaneously with the antacid for better digestion. B. At least 1 to 2 hours before or after the antacid. C. Immediately after the antacid for maximum effect. D. Only if stomach upset occurs from the other medications. Answer B. At least 1 to 2 hours before or after the antacid. This question focuses on drug interactions related to antacids. The core concept is understanding how antacids can interfere with the absorption of other medications. Antacids can alter gastric pH and bind to other drugs, reducing their absorption and effectiveness. For instance, if a client takes an antibiotic at the same time as an antacid, the antibiotic might not be fully absorbed, making it less effective. Always remember to separate antacid administration from other medications to ensure proper absorption of all drugs. Question 23. A client receiving intravenous vancomycin reports ringing in their ears and dizziness. Which action should the nurse take next? A. Administer an antiemetic as prescribed. B. Slow the infusion rate and assess for red man syndrome. C. Notify the healthcare provider and request an audiogram. D. Reassure the client that these are expected side effects. Answer C. Notify the healthcare provider and request an audiogram. This question addresses recognizing a significant adverse effect of vancomycin. The core concept is understanding the risk of ototoxicity associated with vancomycin, especially with rapid infusion or high trough levels. Ringing in the ears, tinnitus, and dizziness are signs of ototoxicity, which can lead to permanent hearing damage if not addressed. For example, continued administration of vancomycin without addressing these symptoms could result in irreversible hearing loss. Always remember that ototoxicity is a serious concern with vancomycin, so report these symptoms immediately. Question 24. A nurse is caring for a client who received atropine. The nurse should anticipate which of the following effects? A. Increased salivation. B. Pupillary constriction. C. Decreased heart rate. D. Dry mouth. Answer D. Dry mouth. This question tests knowledge of the anticholinergic effects of atropine. The core concept is that atropine blocks acetylcholine, leading to drying and slowing effects in the body. As an anticholinergic medication, atropine inhibits the parasympathetic nervous system, resulting in effects such as dry mouth, increased heart rate, and pupil dilation. For example, if a client receives atropine before surgery to decrease secretions, they will likely experience a very dry mouth. Remember, atropine dries you up and speeds you up, so a dry mouth is a very common and expected side effect. Question 25. A client with Parkinson's disease is prescribed levodopa/carbidopa, Sinemet. The nurse should instruct the client that which of the following is a common adverse effect? A. Diarrhea. B. Bradykinesia. C. Orthostatic hypotension. D. Muscle rigidity. Answer C. Orthostatic hypotension. This question addresses a common and important adverse effect of levodopa/carbidopa, used to treat Parkinson's disease. The core concept is understanding the cardiovascular side effects of this medication. Levodopa/carbidopa can cause orthostatic hypotension, which is a significant drop in blood pressure upon standing, leading to dizziness and increased risk of falls. For example, a client might feel lightheaded when getting out of bed, requiring them to sit on the edge of the bed for a moment. Advise clients to change positions slowly to minimize the risk of falls due to orthostatic hypotension.